my heroes, we're almost there. Okay, at this step, we're going to discuss the healing process and the post-operative instructions. Now, to recap, up to this point, we went through different phases. We went through the planning and assessment, we went through the pre-surgical prep, and we went through the surgery. And after the surgery, we left the office with either a fixed-in bridge or a removable full denture. Now, what happens next? Next, we will need you to be on some pain medications to control any kind of discomfort that you might experience. Now, most patients report very little pain, and not necessarily pain, but mostly soreness and tenderness in the gum tissue. And most pain medications that we use will get you really comfortable and have very, very little discomfort with the process. Now, we will also ask you to continue taking your antibiotics, your vitamins, and your antioxidants, as well as continue to rinse with the mouthwash that we gave you. Those are very important pieces to help you heal up a little bit quicker and fight any infections that might come up after the surgery. All right, now, from there, I will ask you to kind of limit your activity as much as you can and get as much sleep as you can. Now, sleep is how we heal. So I know it might seem counterintuitive, but I need you to sleep as much as possible. Now, in some patients, we might ask you to sleep upward, okay, with your head elevated. So plan on that, and I'll give you notice if you're, the patient that needs to do that. Now, from there, we're going to ask you also to ice. In the first 48 hours, it's very, very important to ice. Icing reduces inflammation and swelling dramatically. So what we're going to do, we're going to take a Ziploc bag, put some water and ice in it, and put compresses 20 minutes on, 20 minutes off on the area, and do it every 3 hours. And that's crucial in the first 48 hours. Now, with that in mind, ice cream is your friend. You can eat a lot of ice cream in that 48-hour window. Okay. Now, next, some patients might experience a little bit of bruising, which sometimes can happen. If that happens, we want you to do warm compresses, not cold, warm after day 4. Okay. That helps, get those, bruises kind of to disappear a lot quicker. Now, from there, we want to also make sure that we are, if you're a patient that smokes, we're not smoking, okay? Smoking can increase the risk of complications dramatically. So definitely, no smoking whatsoever. If we're going to smoke, we're going to have complications. Okay. Now, from there, I also would want you to watch what you eat, okay? There's some modifications to your diet that we're going to talk about. And some of these can be, for example, being on a liquid or a soft diet, anywhere from a couple of days to up to 8 weeks after. So those are things that are very important to understand, okay? And follow. That's crucial in some scenarios, okay? Now, after all that, and obviously we'll give you a sheet with all these instructions once you come into the office, but we'll see each other for post-op visits on a regular basis in the first 3 months, just to ensure there is no complications, okay? Yeah, you heard it right. Complications. Complications can come up anytime we do any type of surgery in the body. So I have a video dedicated for these complications. You can, go and watch that. But we tried to keep these complications as minimal as possible. And I hope you appreciate by now all the precautions that we're taking to do just that. And that's going to involve you and following the instructions and the recommendations that we give you to ensure that this process has the least amount of complications possible. So in that part, we need your help and we need you to follow all these instructions. Okay. All right. Now, after we're done with this healing stage, okay, now we are ready to move on to the final teeth, and that's coming up next.